Hello, Eileen Davidson here, and my last sunny day here in Barcelona. I've had a little bit of technical difficulties, so I've had to redo some of my debriefs for you. So, this one is on cannabis, and this session was a debate between two doctors, one from Israel and one from the US, and they're kind of assigned a topic. It's not necessarily something that they specialize in, but they are assigned a topic, and they're supposed to look through all the evidence and kind of like display, this is the no side, this is the yes side, basically. So there were two questions that they had to kind of debate on, and then those in the audience that were healthcare providers would vote on two questions. One was, do they prescribe cannabis to their patients? And do they think that cannabis should be legalized? So the results were kind of interesting. In the beginning, 35.4 said that they do recommend cannabis, and 64.86 said no. And then about legalization, it was 68.97 said yes, keep it legal, and 31.03 said no. And that was at the beginning before the debate. Those numbers changed. So some of the arguments that they brought up were interesting. The first professor, he brought up that, cannabis has been used in history for a long time. And recently, the legalization of cannabis has actually created a high prevalence of cannabis use disorders and early use amongst adolescents. And adolescents using marijuana is actually not very good because it affects our frontal lobe or our brain. So it contributes to lower IQ. And he showed some systematic reviews showing there was no significant pain reduction when cannabis is added to opioid treatment. But he didn't really show many other reviews where it wasn't necessarily a pain relief for other conditions. He highlighted that there are health risks with taking cannabis, but just like our medications, there's also health risks. So he says that there is a significant lack of pain reduction in patients using cannabis for chronic pain. I'm curious, do you agree with him there? And he also highlighted the potential negative effects of long-term cannabis, including increased sensitivity and severity of pain. He also provides an overview of the current legal status of cannabis, and noting that while federal law considers it a substance, many states have legalized it for medical and recreational use. He also went over that many CBD products that you buy in the store actually still do contain too much high dose of THC, and that's concerning for those people that don't want too much THC, so they don't include any of the components that make you feel high. He said that the risks associated with cannabis use during pregnancy include a high risk of preeclampsia and maternal anemia. And he shared data on how increased risk of neonatal complications in babies born to cannabis use mothers. And he emphasized the need for rigorous campaigns and increased taxes to reduce cannabis use, similar to the approach taken with cigarettes and opioids. Then he focused on what it does to the mental health. So this, he said that it's a correlation between cannabis use and mental health issues, including bipolar disorder and schizophrenia. And he showed that there was some data, a high conversion rate to schizophrenia and bipolar disorder among cannabis users. Have you ever heard of this, or have you ever met anybody who has experienced this? And that, with high THC products, cannabis products, that there is a higher increase of psychosis. And also, there has been an increase in ER visits and a risk of dementia among young adults who use heavy amounts of cannabis. He also highlighted there are some cardiovascular health risks, including increased blood pressure and reduced left ventricle ejection fraction. He shared data that high doses of cannabis can also increase the risk of myocardial infarction and hypertension, but hypertension is low. High blood pressure, so sorry, I'm repeating myself. The professor highlights also the mortality risk of cardiovascular diseases among cannabis users, but there wasn't really much, significant data on this. He emphasizes also the need to understand the long-term effects on cannabis health. So you'll hear over and over again that there's just not enough research or evidence behind cannabis, and I see that there is more and more call for this. He stated that there is potential risk of cancer in patients using cannabis, and mostly frequent and long-term users. And again, he said more research needs to be on this. And understanding the importance of balancing the potential benefits of cannabis and its known health risks. So then it went to the physician from Israel, and his side was the yes side. So he showed some background how cannabis has been used for centuries, even in China, where it's now illegal. And, he talked about the different ways that you can use cannabis. It doesn't have to just be smoking. It can include inhalation with a vape or indigestion with edibles. You can even wear patches or topicals. And then he also showed that there has been data that has shown that there is benefit effects of cannabis on inflammation and pain management. So it's a little bit confusing because they both saying the wrong thing. And it's like, well, where's the data highest? And how are they doing these studies? So yeah, it's kind of interesting. And he said that there was a number of benefits in using cannabis to treat diseases, autoimmune diseases, particularly rheumatoid arthritis and fibromyalgia. There's not many drugs for fibromyalgia or scleroderma, and these are two drugs that those patients have reported relief from. Including pain reduction and improved quality of life. So that's important, especially if you note the improved quality of life part. And that, the cannabinoids, which are the anti-inflammatory part of cannabis, can actually reduce inflammation. And like the other professor, he also highlighted there is so much more need for research in this area. He did go over the side effects, including that, it can include memory loss, psychosis, and addiction, though it's a little bit more rare. And data showed the risk of addiction is lower than that of substances like alcohol and opioids. And, proper dosing and supervision is important when prescribing cannabis to patients. And once again, highlighting that there needs to be more long-term studies on the effects of cannabis and health. So that was kind of their whole argument. And at the end, remember I said these numbers before. They were recommend, yes was 35.14, no was 65.86, but then at the end, after the arguments, the ones that said that they would be willing to prescribe it to their patients went up to 40%, and then actually went down to no. But then, this is where it was a little surprising, because remember the legalization numbers? They were originally, yes, keep it legalized, and that was 68.97%, and the no was 31.3%, and it actually changed a bit more, and in a direction that I wasn't kind of expecting. So legalized actually went down to 66.7%, and then that was for yes, keep it legal, but no went from 33, or it went originally from 31.3 down to 33. So you see how there's lots of threes in those numbers. It's kind of a tongue twister, and I'm tired after the last day of the conference. So I thought it was kind of interesting how people thought maybe it shouldn't be legalized, because one of the doctors also highlighted that there has been an increase in ER visits, there has been an increase in motor vehicle accidents, some cases where there has been cannabis psychosis that have resulted in someone's death. However, he showed news headlines from like Daily Mail UK, Edmonton News, and another one, and while they were nice headlines that are going to be eye-catching, as a writer, I know you should never just go by an article's headline. There could be more information in those articles that may say something like user had a previous history of psychosis or mental health problems. So you need to take that in consideration. And then one thing the first speaker did not bring up, but the second speaker brought up that really stood out to me, and as a patient with a rheumatic disease who does use cannabis as a pain relief, he said, or this is with the Israel one, he said that all of our medications have side effects too, sometimes even worse than cannabis. So it really should be a shared decision making between the healthcare provider and the patient. Obviously, you're going to increase their health literacy. They need to know the risks. They need to know how to take it safely and be monitored. And I agree with that part. So I was happy to see that, the yes, they went up, that more physicians would actually be willing to help prescribe it to patients, especially those with fibromyalgia, scleroderma, and even the study that was highlighted about rheumatoid arthritis. So I'm curious, do you think cannabis should be prescribed by providers, or do you use cannabis for your any pain relief? And it's not just pain relief. There's mental health relief, there's sleep relief, and there was high studies showing that patients who had pain from rheumatoid arthritis had a significant decrease in pain and increase in sleep quality. So that's really important. If we get better sleep, of course we're going to have less pain and less symptoms throughout the day. So I'm curious. Drop your thoughts in the comments, because I would love to read them, and let's keep this discussion going.